Okay, so new news. Prilosec, Protonics, and other what are called proton pump inhibitors are drugs that are some of the most commonly prescribed drugs in the world. And there are many, many, many hundreds of thousands, millions of people that are scheduled to be on those drugs for the rest of their lives. And that is the group of people who suffer from what they call gastroesophageal reflux disease, or GERD. Okay? So there's lots of people in America and around the world that have that disease. And basically, most gastroenterologists say, just take Prilosec, omeprazole, Protonics, Nexium, the purple pill. Take those drugs forever. Okay? Now, they've been out for a while. Millions of people are taking it, and they found, not surprisingly, they have some side effects. They're pretty uncommon, but we should know about them, because then they'll help us decide, for our patients, should you take them forever or not. The three things they found are, number one, that the Prilosec type drugs drops the pH in your stomach. That means it lowers the amount of acid. That's the idea. They're antacids. When you lower the amount of acid, two things can happen. One is you get less calcium absorption, because calcium is absorbed better in an acidic environment. So they found that people taking Prilosec forever can have a greater incidence of osteoporosis, weak bones. So maybe you want to think twice about that. Maybe you want to take some extra calcium. Maybe you want to do some extra work. Maybe you want to check your bones for osteoporosis. But low amounts of acid will interfere with calcium absorption forever if you take it for a long time, so be careful. The second thing they found of raising the pH and lowering the acid content by taking Prilosec forever is you increase the risk slightly of a very deadly infection caused by Clostridia difficile, a real scary bug that rarely causes infection in the colon and bloody diarrhea. And that's uncommon. It's becoming slightly more common than it used to be 10 or 20 years ago. But again, without the acid in your stomach, that becomes a little bit more of a chance of growing inside you. So if you get diarrhea or problems, you want to pay attention to it early. Always worry about that after our surgery, and always contact me and your doctor right away. Those are two things. And the third thing, which might be most important if you have heart disease, if you take Plavix, an antiplatelet drug for your heart, it may be possible that the Prilosec may slightly interfere with the effectiveness of the Plavix in preventing heart attacks. So those are the three new things we know about the PPIs, or the proton pump inhibitors, that are out there. Now, back to our patients. Should all of our patients take Prilosec forever after the surgery? I don't think so. How long should all of our patients take the medicine? I don't know, between 6 months and 2 years, something like that. If you get an ulcer, or a perforated ulcer, or a bleeding ulcer, you may need to take it for years and then reevaluate and see whether you should continue taking it after that by re-endoscoping or something like that. Does that answer your question?
Well, I never had a problem before, so probably, yes, it answered my question in that.
I think you could probably consider stopping it. Beware if you stop it. We recommend everybody do the orange juice test every morning. Basically, if you had a cut and you put orange juice on the open cut, it would sting and burn. We hope, although it's not perfect, is that if you put acid from orange juice in the lining of your stomach and you had an ulcer there, it would feel a little uncomfortable and be a warning that you should call us and check into it.
Okay.
But I don't think every one of our patients need to take a proton pump inhibitor forever for life. And then how soon they stop, and somewhere between 6 months and 2 years is probably okay. If, God forbid, you had ulcers and gastritis and had to take it for the rest of your life, you're in good company. Millions of other people are doing that, and it's probably okay, But there might be some other things you want to do. Maybe a little bit more yogurt to get in the calcium and things like that. And so there might be some other things you want to do. Did you have a question?
I'm just going to say maybe with the calcium, they have the calcium added to orange juice. Would the calcium change the acidity in the orange juice, or would it still be effective to be able to kind of do two things at once?
I wouldn't get calcium added orange juice.
Okay.
So that's the latest on